Good evening. My name is Andrew Ham, and I'm here with the state of Georgia Public Health. And I'm here to raise a vote for the policy in place. And this policy is for the prevention of teen pregnancy and reducing teen STI rates. The issue that I see as an overwhelming need to help within the community in Georgia as a public health advisor is prevention of teen pregnancies, the reduction of teen STI rates, proper education of these issues, and a place to call and be seen if you are a teen in need of help with these issues. When discussing prevention and reduction of teen pregnancy, STI rates, education, and a place to be seen in private for these issues, we have to consider a lot of things. Who does this affect? What is the impact on the health and the community? Why does the health issue need to be resolved or addressed? It affects teens, adolescents, their parents, grandparents, their families, partners of those teens, the child that could be born or not due to complications, health care due to pregnancy and STI related issues, as well as funding for those things. Also state funding, the community's health, and our providers to take care of all these. What is the impact of the health issue on the community? This is a widespread problem, not only for the complications with birth, grandparents having to become parents again, adoption, load increase without an increase in medical needs. There are medical problems for those affected by an STI, limiting chances of them getting pregnant later on in life if they want to, as well as a lack of education. There's also developing other symptoms or other harmful diseases that are associated with STIs. Also, the increase the amount of money the state has to put into medication, training, and its employees to take care of these patients from preventable diseases, from a policy that we could put in place now and prevent these measures from happening, reduce our massive funding for all of these, help educate our students from 8th grade and beyond, let them know that it's a mandatory course in high school. It's an elective. We're going to take funding straight from all the other electives. It's the same pot of money. You're not going to lose or gain any money in the school system. The only thing you may have to do is hire a few extra teachers that can deal with a secret or private policy regarding those children in need or those teens in need. Why does this health issue need to be addressed? Some studies say 1 in every 3 teens will become in contact or get an STI between the ages of 15 to 24. That's brought to us from Costa, Barbosa, and Araujo in 2016. Also, teen pregnancy is largely up. This results in the rising and raising of teen abortions, healthcare costs, as well as putting financial and political and religious strain on the community. Now, we all know that pro-choice, women's rights, it's their body, it's their use. We all know these are tough political issues that we have to face in our world today. And I'm not having you say that you're pro-choice, you're pro-life, you're pro-this, you're pro-that. I'm not having you say that. I want you to go for this policy because it gives you the best way for you to address this issue as a teen today. Whether if you're pro-choice and you want to go ahead and make a choice with your body, this is going to give you that avenue to do that. It's going to give you all the education you need to become a mother or to have a child or to prevent getting an STI. It's also going to help all those that are pro-choice and pro-life. Pro-life members, they don't want abortion. I don't want an abortion, but at the same time, if that's what they want to do, then that's up to them. I can't change the legislation on that. But I'm here to say that if you are pro-life, this will help you. because it's going to give you all the necessary medical needs that you would need in our state. Clearly, teens, mothers have lower levels of socioeconomic attainment than their childless peers. They are less likely to complete high school and attend college or earn a bachelor's degree, and they tend to earn less than those without children at their age and are more likely to experience poverty. Now, why would we want our teens today to grow up knowing that they're going to already be at the back end of our society? Our teens and our kids, they're our future for tomorrow. Let's help them with this policy. Let's help them get to where they need to be by educating them. This is one thing that we can prevent for all teens in the nation. You can prevent this. Adults, teens, children, whatever, you can prevent it by getting the right education, learning how to have safe sex and safe protection. Using those means will help you to not have these problems. It will not set you back in life. It will not give you medical problems. It will not give you the inability to have children if you're a woman and you contract an STI. And now years later, you didn't know you had it because you didn't know what the signs and symptoms were, and you didn't know how to have safe sex. Well, guess what? Now you can get that education. You can use this policy today to get the education you need, to get our teens and our youth and our community healthy, safe, and with the right frame of mind to know if they are going to do certain things, that they know how to do them safely and they can prevent those STIs from happening. And they can also be seen in private as a teen without their family having to know, without them being conflicted. Well, is my mom going to be mad at me? Don't even bring that into the equation. We're going to set them up with a teen clinic and a teen clinic hotline where they can put in messages and find out what they need to do and how they need to do it, as well as being seen for the first time with women issues or with male issues or anything else that's going on. We're going to provide that to them as a service for public health. What better way to promote public health and community health? There is also a huge risk of teens having children early in their life, as the body may more frequently reject births. Also at a higher risk of complications during pregnancies due to the inability of the body to be fully developed. Implementing evidence-based on sexuality education within and beyond the schools have both success and challenges among the grantee organizations. Project leaders identified significant factors that contributed towards successful implementation, as brought to us by Saunders. Lastly, teens shouldn't have to have lasting effects from STIs or have a disease infection that is totally and completely preventable. When creating a policy to help with health issues, you have to look at multiple things to include, but not limited to, community health, adverse effects on the community, population that is affected by the adverse effect. Is there a way to reduce the measure? Is the measure large enough or high enough value to be bothered with a new policy or to help resolve that issue? There are just a few of the questions and things we think about when coming up with these policies. And we thought about all of those when we came up with this policy. Who will be affected? The policy will be an outreach, and we'll start with getting a bill passed to allow for new retraining of sexual education to start in the 8th grade and continue as a class that must be taken to graduate in high school. These classes will reach teens, allow further education of sexual relations, safe sex, and all the avenues for teen pregnancies. But the number one goal would be to reduce teen pregnancies and decrease STIs in an age group, while at the same time offering credible education and also a safe private clinic for teens to go to if they don't want anyone else to know what's going on in their life. This policy addresses health issues. Policy will not only address the issue head on, it will allow for answers, explanations, difficult times, and questions. It will meet the affected age group head on in the schools and in teen clinics. This will change the current policy of abstinence and become a regular course. Yes, abstinence is always going to be the number one prevention of this. But let's go ahead. We know the way that society works now.